Good morning. This is Susan Frampton, the president of Planetree International, and it's really wonderful to be here with you to participate in this program. What I would like to do is to provide an update to you on Planetree's response to the COVID-19 crisis. First, I would like to thank all of you for your dedication and your continued work to support patients, families, and healthcare teams at a very, very challenging time. When I think about the COVID-19 crisis and where to begin a response, I always start with our people. And I encourage all of us to think about our people, our staff, and their needs at this time. In order for us to continue to deliver the very best care to patients and their families, we have to make sure that our own caregivers are supported and to reassure them that while this is a great challenge, we will get through this together, that we will be challenged to bring our creativity and our best thinking to this situation, that we will need to become more virtual ready in a world where being close together in person may not be as available. And so I share with you some of the pictures from our online happy hours that we do with our staff on a regular basis to keep everyone engaged and feeling a part of the team. Let me talk about our affiliates and our clients and how the COVID-19 situation has affected them. We began to see very early in March that most travel internationally was curtailed. And so we were not able to be with our clients around the world. And we had to find new ways to engage with them. And so we began to look at all of our services and our support materials and to prepare to deliver these virtually to sites all over the world. Our members have let us know that they have a very great need now for assistance to care for their own caregivers. And as we all know, healthcare professionals are very, very stressed by the COVID-19 situation and the conditions that they may be working in. And so our ability to be there to help support hospitals and long-term care centers and clinics to provide care for their own staff is even more important now than it ever was. We've had many, many conversations with members around the world about their concerns of how do we balance protecting people from the virus, but maintaining our commitment to being person-centered, particularly around the issue of having family present with their loved ones in healthcare settings. We've also been working with organizations who have had to furlough staff or have staff stay at home. And as they begin to bring them back into the healthcare workplace, how you reintegrate those furloughed staff members. And then lastly, there's been a great demand for skills training as more healthcare is being delivered via telehealth and on virtual platforms. We realize that many of our healthcare providers, physicians, nurses, pharmacists, have no training in communication skills for telehealth, and it is a very different delivery platform. And so we're doing more and more work in these areas. In addition, we've been doing a great deal of advocacy work internationally with our wonderful international partners, including Planetree Latin America. We very quickly realized, as we heard more and more stories about the impact of the virus on person-centered approaches to care, that we needed to provide guidance to healthcare provider organizations, particularly around the challenges to family presence. We held our first webinar focused on how we might remain person-centered during the pandemic back in the middle of March. We had many people from around the world join that webinar and join that conversation. And then our partner offices began to hold their own webinars, again, to support their network in helping them to remain person-centered and to deal with these new challenges that we face today. Planetree Latin America has done a wonderful job of continuing with a series of webinars to support their members. Also, our colleagues in the Netherlands, Planetree Netherlands, has done a series of these webinars, and Planetree Francophone, located in Quebec, has also continued to provide online resources to their members. I will say that one of our biggest challenges has been family presence. And you may have heard some of the stories that, of course, we're beginning to see now in the media about the unintended consequences of restricting families from being with their loved ones in healthcare settings. This has been extremely challenging to healthcare professionals as they have tried to both balance safety concerns with the emotional and psychological needs of their patients. And so we recently brought together a coalition of 60 leading organizations across person-centered care, quality and safety, and patient and family advocacy. This group came together very rapidly in order to develop a set of guidelines that could be used to respond in a person-centered way to family presence in both long-term care and acute care in ambulatory settings. And those guidelines were released this morning, and I hope that many of you have received copies. They set out a evidence-based and compassionate set of guidelines to manage family presence in healthcare settings during the pandemic. We hope that you will consider joining that effort and endorsing those guidelines. They've gone out to over 16,000 social media contacts on our network and are being shared across the world by many of our partner organizations, including the International Health Promoting Hospitals Network, the International Society for Quality in Healthcare, which will be issuing a joint statement supporting those family presence guidelines shortly. And so our advocacy work has continued. We've developed more and more resources that hospitals and healthcare centers are expressing a need for. And this includes thinking about the way that we talk to our patients, the way that we communicate about the virus situation with our families and with our communities, and being conscious about using supportive language, of providing outlets for physicians. For instance, we're doing something called the break room for physicians so they can come together and talk about the pressures that they're under, the experiences that they're having during this time. But maintaining our commitment to being kind, caring, and compassionate, even in this very challenging time. We are, unfortunately, having to cancel our in-person conference, which was scheduled in October in New Orleans. We will be providing some virtual replacements for that, and then looking forward to 2021. We've also extended the terms of our certification for those of you that may be involved in the certification process for excellence in person-centered care. We have extensions of 6 months for organizations that are on that journey in order to be sensitive to the need for sites to be focusing on the response to the virus presently. And then I'll finish by saying just a word about, I think, our collective future as healthcare, as a healthcare industry, that we will continue to need to find ways to engage with one another and to engage with our patients and with families in new ways that we will not always be able to be together in person, that we will need to look in part to technology, but that we also need to be careful about how we use that technology, and that we use it responsibly and we use it compassionately to continue to engage with patients and families as we move forward into the future. Thank you so much.